Adverse drug reaction is any harmful, unwanted response of a drug. So, what is the difference between the adverse drug reaction and the side effect? Adverse drug reaction can happen even though you took the drug at the right way, right dose, right time. And this adverse drug reaction can be predictable or unpredictable. It can be dose related or it may not be dose related. And adverse drug reactions are always very, very dangerous and they must be reported quickly. So, what is the difference between the side effects? Side effect is any effect of the drug that is not the main effect that we want, but it can be helpful or harmless. So, side effects can be helpful or harmless, and side effects are usually predictable. And for example, I'm going to be giving you an example. How can they be helpful? Let's say that you're taking antihistamines for the allergy, right? And it's causing sleepiness. It's good for what? Insomnia. So it's not always harmful. Side effects are always not harmful, but adverse drug reactions are very, very dangerous. They must be reported quickly. They can be predictable, unpredictable, dose related, or they may not be dose related. So yeah, even if you take it at right dose, blah blah blah, it's very serious. So I'm going to be giving you example of morphine. Morphine's side effect is constipation. Is constipation very, very dangerous? No, but it's disturbing, right? But adverse drug reaction of the morphine is respiratory depression, which means slow breathing. Your breathing stops. You can even die. It can even cause death. So that's the difference between them. And when someone says adverse drug reactions, you must know this classification. You must know these types, these groups. A, B, C, D, F. It will go like that. Or first type is type A, which is augmented. So these are predictable. These are dose related. These are related with the drug's action. For example, warfarin, bleeding, as we all know. Insulin, hypoglycemia. Morphine, constipation. And type B, bizarre, it is not related with the drug's normal action or it's unpredictable. It's not dose dependent, often due to allergy or genetic problems. It's very rare but serious, such as penicillin anaphylaxis. And type C is chronic use due to the long-term use, such as corticosteroids causing Cushing syndrome or osteoporosis after using for a long term. Type D delayed appears long time after you're using it. Let's say that you took the drug, you're not taking it anymore, but after some term, you're getting these effects. Cancer after seeing chemotherapy, birth defects from thalidomide. I'm going to go to past right now. There were some kind of drugs as we remember, like thalidomide, warfarin, isotretinoin. These were never given to pregnant people. I just wanted to remind you that. So birth defects from thalidomide. And type E, end of use, when drug is suddenly stopped, stopping benzodiazepines seizures. As we know that we should not stop drugs immediately if our doctor doesn't tell us anything. So stopping opioids, we can see withdrawal symptoms. And type F, failure of therapy, when drug does not work as expected. This is happening in oral contraceptives. This is very dangerous. I mean, oral contraceptive failure can be happen with the interaction of the other drugs, or like even if you take St. John's wort plant, as we remember, it was inducing the drug's effects. That's very risky situation, so we must be careful with the especially oral contraceptives, or like antibiotic resistance can be seen. And who is at high risk for the adverse drug reactions? Elderly patients, children, patient with kidney or liver problems as usual, patients taking many drugs together, because drug interactions can happen and it can reduce or increase the drug's effects. Adverse drug reactions should be reported to pharmacovigilance centers. Pharmacovigilance is a science of detecting, understanding, and preventing adverse drug reactions. In Europe, it's going to be Vigilance. You're going to be reporting there. In the USA, it will be FDA MedWatch. In Turkey, it will be TÜPHAM, Türkiye Pharmacovigilance Merkezi. You're going to be writing a report with all of the details, like which food that they took that day, even that one. You're going to be writing your own name. You're going to be writing the hours, when did they take this drug, blah blah blah, like every detail.